Nagalande no stop India mon India activity kuri ase ahi na jail khan de hobi dusra jaga khan na facility alag alag te bi duhan program kuri ase de so itu nishna mohan aji abunyan bi bhabi thakibo pare ki man bishi manu aise kile mohan ke matise confuse bi thakibole pare na boi bi lagi ase bola kunuba tu na jane khobor do na to idika bi hobo pare bole bi mohan kobole mundo aji do mohan সব মানুহ মহান ভাল ভাল কাৰণে প্ৰগ্ৰাম এটা প্ল্যান কৰি নাহা আছে দে তো এনেকা কৰি না মহান কিলে এইটো কৰি আছে মই অলপ কৈ দিব কি মহান এইটো হেল্থ তো বেছি ইম্পৰ্টেণ্ট আছে তো না নহয় না কোন কোন হলে গাঁও ইমান ছোট একটা ইয়াতে কাটা একটা যাইলে মহান এইটোৱে ভাবি না কাম কৰি থাকিলে আৰু লাগিছে বুইতো না এইটো নিচিনা হয় এইটো কাৰণে মহান হেল্থটো মহান কাৰণে সব বেছি ইম্পৰ্টেণ্ট আছে না তো ইয়াতে কৰিবলৈ আছে টেষ্টি আপুনি লগা হেল্থ খান কোনোবা বিপি কেনে আছে weight ঠিক আছে না নাই sugar খান নলবি কি আসলে আপুনি আল্লাহ হেল্থ খান না ঠিক আছে না নাই জেনারেল চেকআপ মান যাইলে মানুহ চাইলো না ডক্টৰ খান পৰা ইটো নিচিনা চাব দে ইনিগা নিচিনা বি কৰিব আৰু ফেসিলিটি থাকিব কি HIV টেষ্টিং খান বি কৰিব তো HIV টেষ্টিং কৰিলে বহি লাগি আছে বলা মহান চব না তো ইটো নিচিনা ইয়াতে মহান কি লে কৰিবলৈ আহি আছে বলে ইটো HIV টেষ্টিং খান হলিবি কৰিব মহান কৰি না চাবলে বহি না লাগিবি তো I would like to take this privilege to just highlight very quickly on why we are conducting this ISHTH campaign. This has been necessitated. The intensive campaign has been necessitated nationally. So this is not only happening in Nagaland, it's happening all over India. So this is a national campaign that has been necessitated because of the prevalence in terms of the HIV epidemic that is observed in the prison and close settings in India. So unfortunately, Nagaland is also the third highest in terms of prison prevalence in India. Next to Mizoram and Punjab, they have high load prisoners, but in terms of the epidemic prevalence, we are third, which is very worrisome. Though our number is not as big as other states, it's a worrisome situation for us all. In 2019, 2021, two different surveillance have been conducted nationally. So using the national surveillance methods, which is standardized for this kind of epidemic surveillances. So based on that, we have also seen like in Nagaland, though our center of surveillance was only Central Jail Dimapur, based on that, we have the results tells us that there's 4.6% prevalence that is there in our prison setup, which is very worrisome. And the second assessment, surveillance also again tells us that it's like 4.57, which is almost 4.6 only. So it's quite a worrisome situation for us as well as the state. This NACO has, from the Ministry of Health and Family Welfare, they had also discussed, deliberated, a kind of, that this necessitated that this intensive campaign should happen across India to see the intensity or the burden of the problem in the prisons and close settings. This launching was anticipated on 15th of May nationally, but due to some technical inconveniences, it has been postponed. And during that time, we also had formed the State Oversight Committee here in the prison officials under the leadership of the DG Prison, as well as the Social Welfare Department. We all came together, district administrations leading the team at the district level under the DC. So this district oversight committee as well as the state oversight committee was formed, and then we had an intensive meeting for this launching on 2nd of May this year under the chairmanship of our Commissioner and Secretary, Health and Family Welfare. What we are planning to do during this campaign is that we are looking forward to doing some comprehensive health camps, which includes basic testing. So we'll have medical team in all the camps. We have listed out, we had worked out who should be where on which date. Accordingly, the team will go and there'll be a basic screening. General health checkup facilities will also be made available. In addition to that, we will be looking at HIV testing, syphilis, which is a sexually transmitted infection, STI screening, the TB, Hepatitis B and Hepatitis C. These are the 6 major screening that will happen across during this campaign. in addition to other general health checkup and support provided by the medical team in the prisons, in all the prisons and the closed settings in Nagaland. Post-linkages is something that we are also looking at. Supposing, we might be wondering if this is just a one-time activity, that supposing like someone is like HIV positive, or supposing someone is hepatitis reactive, you know, then these are, or TB for that matter, someone has TB infections. So for that matter, we need to put them on treatment. And there are certain things that we need to coordinate very closely with the authorities, be it prison or other closed settings. So we will be ensuring that the linkages for treatment is ensured for all clients who had been confirmed, be it HIV, be it hepatitis, TB or syphilis or any kind of STI. So that is the modalities that we are looking at. Altogether, we are anticipating to cover about 55 or a little more facilities in the state during this. A month is what we have projected. And if everything goes well in terms of, you know, the technicalities and then the climate permits us, then we are anticipating that we'll complete this campaign on the 16th.
Till I think yesterday, after the lockup, we took a statistics of it and it was 673. And I think one of the reasons why there has been an increase in the number of inmates across the jails in the state is because of the high number of arrests which are being made by the police for these drug abuses. Now, having identified the high prevalence of HIV in the prisons, now the moot question is the mode of transmission. I think our PD had rightly mentioned that intravenous drug abuse, that is one, drug using, that's one, and the sexual orientation of those inmates in the prisons. Now that brings us again to the moot question. I think there is a need for a holistic or a synergetic kind of approach to tackle particularly this HIV. Why is the prevalence of HIV so much in those states where there is prohibition? Is there a correlation in that? Is prohibition in these states driving people more towards drug abuse, which again is in turn leading to the high rate of prevalence of HIV in the state? I think this is something which, it can be a research study, why the prevalence of HIV is high in those states which have prohibition. So this is also one aspect which I think we can think of. I think it's a food for thought for all of us, the stakeholders, in a fight towards the restricting or in tackling the issue of HIV, then the other sexually transmitted infections and other related diseases as we see them, as we find them prevalent in prison as well as the other closed setting. Another important aspect which I would like to really highlight is the sustainability of this program. Like our project director had rightly mentioned, how do we sustain this campaign? It's not a one-day effort that will bring about changes. It's not a one-day program or it's not a one-day campaign that is going to see significant changes being brought about in the prison setting or other closed setting like in the drug rehabilitation center or the juvenile homes for that matter. One thing that we have to really understand is those inmates, those prisoners that come to the prisons, we try to treat them we try to rehabilitate them in the best possible manner. The entire concept of prison is again undergoing sea change. We don't call them a place where we incarcerate them, but we try to call it an reformative institute where we try to bring about significant changes in the lifestyle of these people. So sustained effort is very much required. And how is the prison department geared, or how is the prison department equipped to tackle those issues in a sustained manner? To say the least, I think we are very ill-equipped. Number one, we don't have regular healthcare providers. We just have got 5 pharmacists in the 5 jails. We have approached the medical department to at least deploy or depute another 7 pharmacists in the other remaining 7 prisons. And I would really like to request our project director in SEX to intercede on behalf of the prison department, the necessity to have at least the pharmacies in the other 7 prisons where we don't have any health care providers. That is one aspect. Then I would also like to request through the project director and said to, again, on behalf of the prison department, sensitize even the health and family welfare department in the matter of deploying the medical officers to the prisons on time. Because we are really dependent on the medical department as far as providing health care facilities to the inmates are concerned. Apart from this apart from the lack of resources that we are experiencing in the prison department, another aspect which I would really like to emphasize, and I think here the concerted effort of all the stakeholders are very much required. In a sense, there is a need, an extremely important requirement to sensitize not only the prison officials, but even the other executive members of in the prison administration on the various aspects of this campaign that we have launched today, be it in the form of screening of the HIV cases, or in terms of sensitizing the prisons on the various other the ailment that besets the prison as well as the other closed setting. I think sensitization and at the same time imparting training to them, capacity building of all the officials and of all the officials is also very much required. Until and unless we are aware, until and unless we are sensitized, until and unless we are made aware of what it is, what the campaign is all about, we will not be able to convince the inmates also. Because the right to privacy is also an issue which needs to be thought of. And I think in this regards, right down to the warders who come in first, who are the first contact person to the inmates, they have to be sensitized, they have to be trained, they have to be empowered. The capacity has to be built up to ensure that the campaign and then the goal of the government of India as far as making HIV free by 2030 is concerned is carried forward. These are some of the issues which I thought I would like to just flag, and then there are a lot of food for thoughts that needs to be, that needs to be given a second thought, and not only in terms of, having this one day ops or 1 week ops, or 1 week listening campaign. Sustainability is something that we really have to emphasize, and given the kind of resource constraint that this department is faced with, I'm sure the other stakeholding department, be it ISHTH, be it the Health and Family Welfare, be it the Social Welfare Department, a concerted effort is really required to ensure that whatever rate of prevalence is there in the prisons in the state, we are able to bring it down to an acceptable level. I cannot be speaking of the drug addiction centers or the juvenile home, but since prison is my domain, and since these are some of the issues, I thought while thanking the Ministry of Health and Family Welfare and the ISHTH, the Social Welfare Department, and the other stakeholders in this particular campaign, I thought these are some of the issues which we also need to address, because the kind of population that we have in the drug rehabilitation center and other juvenile homes comparatively will be lesser in number than the prisoners that we have in the state.